in premenopausal women, we cycle that progesterone usually somewhere between cycle day 15 through 26 or 27. It just kind of depends and it's very individual. But I have found that to have such an amazing effect in so many symptoms of estrogen dominance. So that's something that we are definitely able to check on blood work and then also manage. So we can definitely improve those symptoms that we talked about. So next, let's talk about our postmenopausal female. So this is the time when, by definition, menopause occurs after no period has occurred for 1 year. That's by definition. Sometimes some women will hit menopause, bam, just like that. Other women, it really takes time, and their periods will kind of go crazy for a year or two before they actually hit menopause. And I think that's also very frustrating because the hormones are just all over the place and they just feel really bad. Some women really go through menopause and have no issues. They don't have symptoms. A lot of times you're going to see that in women who have not had a lot of major life stressors. If you don't have a lot of stress, your body will produce the estrogen, progesterone, and testosterone that it needs even after menopause. It'll produce what's necessary, and it will be a very gradual decline. A lot of times, these women, they manage to have very minimal symptoms, and they do fine. They feel great. So, hormone replacement is not necessary for everyone. However, when symptoms are present, these are symptoms that are usually going to really affect a woman's quality of life. Can't sleep, you feel miserable, you're moody, you're exhausted, you're having hot flashes, just to name a few. That is generally what we are seeing more of nowadays. And again, when we look at the stress response, it makes sense because our bodies have been shuttling so much of the master hormone pregnenolone into stress hormones just to be able to survive. Therefore, the other hormones are now being, they're being affected. They've not been looked after, and they are not being produced in the ideal and optimal levels. So that includes the estrogen, progesterone, and testosterone. So what are some symptoms of basically low estrogen? We're going to go through all of the symptoms of menopause, and majority of these symptoms honestly have to do with loss of estrogen. So estrogen, it really, once it goes down and it's gone, and if it happens very suddenly especially, there are some very, very classic symptoms.